Many of us will experience this constant dull ache here on the top of our shoulders, and it might even be accompanied by a headache which is located here on the temporal bone. Now the chances are that you're struggling with a muscle knot or a myofascial pain syndrome in a muscle called the upper trapezius muscle, which runs from the base of your skull to the top of your shoulder. So I'm going to demonstrate some techniques which will give you immediate pain relief, but I'm also going to demonstrate some strengthening techniques of certain muscles, not the top one, different muscles, but it will help you to decrease and take away the pressure in the upper trapezius muscle so you get more of a longer term fix as well. Okay, let's get started. So the first thing we're going to do is I'm going to demonstrate 3 techniques which will give you immediate pain relief from these knots on top of your shoulder. The first thing I'm going to demonstrate to you is a stretch, a very effective stretch. I'm going to demonstrate this with my right upper trapezius muscle. So what you need to do is sit on a chair and hold on to the seat of your chair. This ensures your shoulder actually stays down, so you're not raising your shoulder up towards your ear. Your shoulder needs to stay down. Yeah, you can also sit on your hand. Another thing you can do. Hold on to the chair, and then from the right side, first thing I need to do is tilt my head to the left. Then we're going to drop my head a little bit forward, about 1 or 2 inches forward. And now in this position, I'm going to turn my head back to the involved side. So in this case, I'm going to turn to the right. Turn to the right here. Yeah, and now I should feel it on the top of my shoulder. Now once I feel this, I'm going to use my left hand in this case to cup my ear, just above my ear, and pull in the line of my forearm. So you see the line of my forearm here. I'm going to pull in the same line of my forearm. Now, devil with this stretch is always in the details. So what you do is you go to the side. This is quite standard. Then you move forward, yeah, and then you rotate towards, in this case, the right. If you don't feel anything, what you do is you tilt your head a bit more, or you drop your head a bit forwards a little bit more. Just play a little bit around with this until you feel that stretch. Once you have the stretch, accentuate it. Hold on to stretch. Now this is another thing you should do. Hold the stretch now for 20 to 30 seconds, not 10 seconds, what you sometimes see in other videos. Hold the 20-30 seconds and repeat it 3 times. It's a very good stretch for the upper trap. Now I'll do the other side also just to demonstrate to you. So on the left side, holding on to the chair again, I'm going to drop my head to the right side, tilt to the right, drop forwards, and then rotate towards my left side in this case. I'm going to accentuate the stretch. Hold it, you can feel that on top of your shoulder there. Hold this again for 30 seconds, repeat about 2 to 3 times, and do this daily. So the first stretch, really good stretch, you immediately feel some relief. The second thing you can do is what we call trigger point therapy. So what you do, very simple, is you find the tenderness on top, and you probably do this yourself anyway, out of instinct. You squeeze it sometimes, so you find a tender spot on top, and all you do now is you add pressure for about 10 to 15 seconds. This might be quite sore, local pain. It might even give you radiating pain down the side of your skull. Don't worry about it, just hold on to it. Yeah, hold on to it. So you do it for 10 to 15 seconds, and then after 10 to 15 seconds, you release. You rotate your shoulder a little bit, you roll a little bit forwards and backwards, and you do this again, and you do it about 3 to 5 times, and then you will get some pain relief doing that as well. Obviously you can use a heat pack, that might work as well, a heat pack on the side, but you can do this as a trigger point therapy. And the other thing you can do is more dynamic exercise, exercise and movement, is you find the tender spot, and then what you do is you raise your shoulder up, or your arm up and down. You do this again for about 10 seconds. So you almost do like a compression mobilization essentially. So you go up and down, and what you can do is you find a different spot, different tendon area of the muscle. Just go on top of your shoulder and you move your arm up and down, and that will also provide you with some relief. So these are 3 really simple and effective techniques you can do throughout the day, at night, maybe when you're watching something on TV, or when I've got a bit of a break at work, or during your lunchtime. Just a few stretches and a little bit of these 2 other techniques which will give you some pain relief. Okay, next up we're going to do some strengthening exercises for some specific muscles that will help you to decrease the tension in the upper trap. Now before I demonstrate which strengthening exercises you should do to relax those muscles on top of your shoulders, I have to take a moment to explain reciprocal inhibition to you first. Because reciprocal inhibition actually is a process in the body, it's almost like a reflex, whereby activating one muscle on one side of the joint automatically relaxes the opposite muscle. Now what I mean by that is I'm going to explain this to you by using the biceps and the triceps. So the function of the biceps, amongst other things, is to bend the elbow, and the function of the triceps is to extend the elbow. Now what happens is this: if the biceps become active and I'm bending my elbow, what this biceps does is it sends a signal to the triceps to say, just relax a bit, it makes my action a bit easier. So you're getting more efficiency from the biceps by relaxing the triceps, because imagine the triceps just wants to extend it. So by activating one muscle, in this case the biceps, we are relaxing another muscle, the triceps. Now what we need to do for the upper traps is we need to strengthen lower scapular stabilizer muscles, which are located here. And by activating them, automatically we relax the upper traps. So it's a very, very great way of relaxing the muscles of your upper trap and thereby reducing the tension in those muscles. Okay, so remember, we're going to now strengthen the lower scapular stabilizers. Super simple, very effective, and all we need is a broomstick for this. So what you need to do is lay face down. I've got a little towel here to support my forehead. Face down. Place the stick in the small of our back, put our hands close together so we're touching our back sides, our buttocks here. And then all we do now is raise the stick up and down, and up and down. And we do 10 repetitions and about 3 sets. So after we've done this, what we do now is we widen our grip, to about 60 degrees angle in our arms, and we come up again. And again, 10 repetitions and 3 sets. Yeah, and the last one, you widen your grip even more, all the way to the side, and then same thing, all the way up and down, and up and down. 10 repetitions, 3 sets, and daily. So these are very, very simple exercises to strengthen the lower scapular stabilizers and thereby relaxing your upper trap muscles. I hope this video was useful for you. You might have learned something new with the reciprocal inhibition term as well, and what it is and how it works in the body. If you found it useful, please don't hesitate. Leave me a quick comment in the box down below. Give me a thumbs up. Subscribe to my channel. If you know anyone struggling from a bit of shoulder pain, please feel free to forward this video to them as well. For now, I'd like to say take care of yourself. Take care of someone else, please, as well if you can. And bye for now. Bye-bye.